Good morning, everybody. First of all, I would like to say thank you very much to Acting Secretary Matt Bettenhausen of the California Emergency Management Agency for being here with us today, and also Dr. Mark Horton, of the Director of California Department of Public Health. Now, as you all know, the swine flu struck our neighbors in Mexico very swiftly and severely. That's why we are in California. We're taking quick actions here to protect everyone from this outbreak. I can assure you that at this time there is no reason for alarm, but we want to go and do everything that we can to make sure that we prevent an outbreak here. We have seen some cases all over the United States. We are monitoring this outbreak minute by minute, and we are working aggressively to slow the swine flu spread in California. I want you to know that the best minds in California are working on this. And when I say the best minds in California, that automatically means the best minds in the world are working on this. My thoughts and my prayers, of course, remain with those that have been infected. And fortunately, all of U.S. cases have been mild and moderate in severity, and everyone has recovered so far. There have been 7 confirmed cases in California, 4 in San Diego County and 3 in Imperial County. There have been 40 cases identified in the United States. And of course, the situation in Mexico is much more severe. As we have heard, there's over 1,000 cases and there's over 100 deaths. The outbreak is a call to action and communication and cooperation on every level. I got daily briefings in these last few days, sometimes twice a day, and I also got briefings from Janet Napolitano from Homeland Security from Washington. And our state health and human services agencies and our Department of Food and Agriculture have taken several critical steps, such as we have activated the Joint Emergency Operations Center, which is a combination of the Public Health Department and also of the California Emergency Management Agency. We have flu experts deployed to Southern California, and we are continuing to communicate with public health officials in Mexico. And we are testing patients with flu-like illnesses statewide, and we have activated our health alert network to be in touch with all the hospitals and doctors and medical centers and so on. The bottom line is we are prepared. The federal government has declared a federal public health emergency, as you know. Yes, we are taking quick actions here in California, but what is important is that every individual out there is helping us and is helping with this. Go to your Department of Public Health website for prevention tips. It's very important. You can get prevention tips, fact sheets, and much more. You will find it on www.cdph.ca.gov. The health and well-being of all Californians is very important. I mean, public safety is our number one priority. That is why I have required around-the-clock coordination with agencies at the local level, at the state level, national, and also international level. And I want to say thank you very much for listening. And now, do you want to quickly make a few remarks, Matt? Please.
Thank you, Governor. And thank you also for your leadership and aggressiveness in terms of looking at this issue and moving forward. We are constantly monitoring, assessing the situation on an hourly, daily basis. I've been very pleased with the cooperation that we've had from the federal, state, and local level. We at California Emergency Management Agencies have daily phone calls with the Department of Homeland Security, our health partners throughout the state of California, and through the Joint Operations Center with California Health and Human Services and the Department of Public Health here in California. Obviously, a lot of things are going on. This is an emerging situation. The situation will change as we get additional information and the epidemiological studies and the investigations that we're conducting and a lot of testing going on throughout the state of California. So I want to thank our first responder partners and our health partners who have been with us and making sure that we are staying on top of it. But we will continue to assess the situation as we get new information about the flu. But as the governor emphasized, there is not reason for alarm. But the most important thing is the public to help us with this, to be able to, if you're ill, do not travel or go to work. If you've been exposed to somebody who has had the flu within the last 7 days, don't travel, do stay at home so that we can mitigate the impact of the flu. We're very fortunate that all the cases have been mild here in the United States, but everybody, it doesn't cost anybody anything to be cautious. Thank you, Governor.
Dr. Horton, do you want to just say a few words, please?
Thanks, Governor. Thanks, Matt. Just to reiterate what the Governor has stated, we are fully engaged with this issue. We are in daily communication with our local health officers throughout the state and with our partners at the federal level at the Centers for Disease Control. We have enhanced our epidemiology, our surveillance efforts in the local areas in San Diego and Imperial County, so that we've got the healthcare community well engaged, so that they're on the lookout for additional cases of influenza-like illness and doing appropriate testing. So we feel like we've done great efforts to enhance our abilities to detect this and get hour-by-hour information on what's happening. Once again, want to iterate what Matt mentioned about the public health with this, to emphasize personal hygiene. Hand washing is still one of the most important things we can do, but it's certainly avoiding crowded conditions if you're in an area where the influenza has shown up already, and other steps that we can take. It's important for the public to be involved in this. So thanks, Governor, for your leadership, and I'll be happy to answer any additional questions.
Please, if you stay here, there will be questions coming up.
How many suspected cases are you looking at right now? And if you don't have a specific number, is it a handful, dozens, hundreds, what have you? And also, what can you tell us about the victims in California already? Had they traveled to Mexico? Did they have any contact with swine or hogs?
Well, first of all, as you know, that the new number for the whole United States is around 40 now, and it was 20 just recently, but then it went up to 40 because of New York. They have found 20 more cases, and we in California have identified 7 so far. And maybe, Doctor, you can talk a little bit about those 7 cases, if we know any details about that.
We know that the cases have been mostly unrelated. There was one instance where a father and daughter were infected by a same third source. We are close to being able to confirm yet an 8th case here in California, and we are following, my information is about a dozen additional probable cases here in California. That is the one that we are looking at very closely, and may well be confirmed today. The ones here in California, the question was there any connection with Mexico? The ones here in California have not had connectivity with travel to or relatives in Mexico.
Do we have a microphone? Because we can hear you.
Gentlemen, 2 questions. One, how close are the ties between the Public Health Service and the various school districts around here, and are you alerting those people to notify you if you've got students who are out for 2, 3, 4 days with flu-like symptoms? Second, Doctor, perhaps you can look at this as protocols. Is there a trigger point to where you will request Tamiflu in inoculations or other things to come into California? At what point do we reach that point where we'll ask the CDC to provide it here?
With regard to connectivity with the schools, I have already personally been in contact with the Superintendent of Public Instructions, and we are working both at the state level and at the local level, ensuring good communication and cooperation between schools and the public health authorities locally. And your second question was? Oh, yes. We are on an hourly basis reevaluating the criteria and conditions under which we would lean forward and modify current recommendations about the use of Tamiflu. The governor has been in communication through us with the Centers for Disease Control, and they are now delivering 25% of our allotment of Tamiflu that's been stockpiled at the national level. So we're moving forward to pre-position resources that may be needed if this thing continues to accelerate.
Yet, and there are no protocols yet for inoculations, correct?
There are no protocols for inoculation at this current time. We are aware that the Centers for Disease Control has already taken the virus that's been identified as the new strain of swine flu and created what they call a seed virus that can be used to produce a new vaccine. So that process is in place, and they are making decisions about when and to what extent they will develop a new vaccine. That decision has not been made at the present time.
Here who are low income, they're not going to go to a doctor, and there are flu-like symptoms that travel throughout the population anyway. What's your recommendation to people who think they might have it? Should they be reporting to a hospital? Should they be reporting to a doctor? How are you going to know? How are you going to track this?
Once again, we have the healthcare community fully engaged, so that private physicians, emergency rooms, hospitals, clinics have all been alerted to this and are monitoring the situation. Certainly, there are individuals with limited access to healthcare facilities, maybe not having their own personal physician. We would request, particularly if they have symptoms of influenza-like illness, that they may want to contact resources locally as to what resources may be available to them, either emergency rooms, community clinics, or free clinics that they could access in order to get proper medical assessment.
Governor, addressing the issue about the European community, their health commissioner went a step farther this morning and said that he wants Europeans to avoid coming to the United States and Mexico. Can you comment on that and how something like that would affect California, please?
Well, first of all, we are not at that stage here because we are at stage 3. We maybe will go to stage 4, and at that point, we are just trying to reach out and contain what is going on, and also just let people know to participate. And like you heard earlier, if they feel any illness, to go to a clinic, to go to the doctor, so that we are aware of that. But we are not yet at this point telling people not to travel to Mexico or to travel to Europe or to travel to Canada or anywhere else. So that may be a stage that we will get into, but not at this point.
But he's talking about people coming to America, coming to the United States, to California in particular. He's telling them not to do it unless they absolutely have to.
It's probably a wise decision for them. If you look at it, well, for California, no. Obviously, you have to always do what is best for the health and for the safety of our citizens. That's what it's all about. There are some people that say, well, this will slow down tourism, this will be terrible for the economy and all this. But I think that the number one, I think that we have to concentrate on is just the safety of the people and to make sure that this problem goes away as quickly as possible and that we don't kind of pull back and then all of a sudden it's out of control, because then it's much worse. We have seen that happen before.
States borders with Mexico?
Yes, I think we work together with the Mexican health officials. These are our friends, and we want to work together as much as we can. And there's screenings that are going on, and we are very much aware when people come through. But at the same time, there is no travel restrictions. People can come from Mexico to the United States, and as you know, that issue is, of course, a federal issue anyway. What they're going to do at the border, so if they're going to eventually say, we don't want to allow any planes in, or how are they going to go about it? It's not a California issue. But we're going to work with them together and do everything. The key thing, I think, is for everyone to know that the federal government and the state and the locals and the international community, everyone is working together to go and to solve this problem as quickly as possible. And we're working around the clock, 24 hours a day. Every hour we get briefings on the issue. I get briefings every day from our health officials. And also I'm in contact with the federal government, like I said, with from the health officials and also Homeland Security, Janet Napolitano, who has called me, and I spent a long time with her on the phone the other day. And so we're getting daily briefings from them also.
California is getting, and what will happen to those doses? Where will they go, and what will happen to them, and what will be the recommendation to deal with those?
We are in the federal stockpile, the Strategic National Stockpile. They have 5 million courses of Tamiflu, well, I should say antiviral medications, a combination of Tamiflu and Relenza. We will be getting 25% of that. I think that comes out to be something like 1.325 million courses. We will be receiving that and working closely with local jurisdictions, particularly those that have already experienced cases of influenza-like illness due to swine flu, and we're looking at pre-positioning those supplies of Tamiflu in those counties. That is in process at the present time. They will come to Sacramento initially.
Thank you. Thank you, Governor. Thank you.
Thank you very much, everybody. Thank you.